Every day, I meet people who genuinely believe they're taking care of their health. They tell me they walk regularly, 20, sometimes 30 minutes, even longer. On paper, it sounds perfect. But then they sit across from me and describe a very different reality. Their knees ache. Their legs feel heavy. They complain of fatigue that doesn't make sense. Some even mention tingling or numbness after their walks. And the most confusing part for them is this. Despite all their effort, they feel like their body is slowly getting worse, not better. So I ask them one simple question. Not how long they walk, not how often, but how exactly they walk. And that's where everything changes. Because in most cases, the issue isn't lack of movement. It's incorrect movement. Walking the wrong way doesn't just reduce the benefits, it actively creates damage over time. It stresses your joints in ways they were never designed to handle. It disturbs your posture. It places unnecessary pressure on your cardiovascular system. And perhaps most dangerously, it quietly fuels inflammation throughout your body. In over 15 years of clinical experience, I've seen this pattern repeat itself again and again. Different patients, same outcome. And what's frustrating is this. Most of them were doing something good, but doing it incorrectly turned that good habit into a slow problem. Before we go further, let me be direct with you. The information you're about to hear is not something most people are told during a routine checkup. Modern healthcare often focuses more on managing symptoms than preventing them, and that's exactly why understanding this matters. If you find this valuable, make sure you support this message, because awareness is what keeps people healthy long-term. Now let's start with the foundation. Why does walking become critically important after the age of 50? Because once you cross that threshold, your body begins a series of predictable changes. These are not random. They are part of the natural aging process, but how you respond to them determines everything. The first major change is the gradual loss of muscle mass. This condition is known as sarcopenia. Starting around the age of 50, the body begins to lose muscle at a rate of roughly 1 to 2% per year. At first glance, that might not sound alarming, but over a decade, that translates into a significant decline. And muscle is not just about strength. It plays multiple roles inside your body. It stabilizes your joints, keeping them aligned during movement. It helps regulate blood sugar levels. It supports posture, keeping your spine upright and balanced. And it contributes to coordination and stability when you walk. When muscle mass decreases, all of these systems begin to weaken together. That's when people start noticing instability, fatigue, and increased risk of injury. The second change involves your joints, specifically the cartilage inside them. Cartilage is a smooth, protective layer at the ends of your bones. Unlike most tissues in your body, it doesn't have its own direct blood supply. Instead, it relies on movement to receive nutrients. When you move your joints, a fluid called synovial fluid circulates through the joint space. This fluid delivers essential nutrients to the cartilage and helps maintain its structure. But without regular, proper movement, this process slows down. Over time, the cartilage begins to thin. It loses its elasticity, and eventually, it starts to break down. This is what leads to conditions like osteoarthritis. Now here's the important part. This process is not just about aging. It can be accelerated or slowed depending on how you move. The third change is metabolic. As you get older, your body's basal metabolic rate begins to decline. In simple terms, your body burns fewer calories at rest than it used to. This happens gradually, but the effects are noticeable. The same lifestyle that kept your weight stable in your 30s may lead to weight gain in your 50s. Not because you're doing anything wrong, but because your body is operating differently. The fourth change affects your circulation. Blood vessels gradually lose some of their elasticity. The heart doesn't pump with quite the same efficiency as before. Blood flow, especially to the lower parts of the body like the legs and feet, becomes less effective. This is why many people begin to experience cold feet, muscle cramps at night, or a constant feeling of heaviness in their legs. Now here is where walking becomes powerful. When done correctly, walking targets all four of these systems at the same time. It activates muscles, helping to slow down muscle loss. It stimulates joint movement, supporting cartilage health. It boosts metabolism, helping regulate weight. And it improves circulation, keeping blood flowing efficiently throughout the body. Research consistently shows that individuals who walk regularly have a lower risk of heart disease, type 2 diabetes, bone loss, and even cognitive decline. But, and this is where most people get it wrong, these benefits only apply when walking is done properly. If your walking technique is flawed, you're not just missing out on the benefits, you may actually be adding new problems on top of existing ones. And that brings us to the most important part of this discussion. There are specific, common mistakes that people make while walking. Mistakes that seem harmless, but over time create real damage. In the next part, we're going to break down the first of these mistakes, and it's one that almost everyone makes without realizing it. Now let's move into the first major mistake. And this is something I see across almost every age group, but especially in people over 50. The mistake is simple: starting your walk too fast. Most people step outside and immediately begin walking at full pace. It feels efficient. It feels like you're making the most of your time. But your body doesn't work that way. It is not designed to instantly switch from rest to peak performance. That transition needs to happen gradually, and when you skip it, you create stress inside your body that builds over time. When you start walking too quickly, the first system that suffers is your muscles. At rest, your muscle fibers are relatively cold, meaning they are less flexible and less elastic. Elasticity is what allows muscle tissue to stretch and contract smoothly. Without it, even normal movement begins to create microscopic strain. These are not injuries you feel immediately. They are small, almost invisible disruptions in the muscle fibers. But over time, as they accumulate, they turn into stiffness, soreness, and eventually chronic discomfort that people often blame on aging. At the same time, your joints are not yet prepared for load. Inside every joint is a lubricating substance called synovial fluid. When your body is at rest, this fluid is not evenly distributed across the joint surfaces. It needs movement, gentle, gradual movement, to spread and create a protective layer over the cartilage. If you skip that phase and go straight into faster walking, your joints are essentially operating without proper lubrication. That increases friction, and over time, friction leads to wear. This is one of the silent ways joint degeneration begins to accelerate. Your cardiovascular system also reacts poorly to sudden intensity. When you go from standing still to walking quickly, your heart rate spikes abruptly. Blood pressure rises faster than it needs to. For a younger individual, the body can absorb that change more easily. But after 50, when blood vessels are less flexible, that sudden increase creates unnecessary strain on the vascular system. It's not about immediate danger. It's about repeated stress that builds day after day. The solution to this entire problem is surprisingly simple, and it doesn't require extra time or effort. All it requires is discipline in how you begin. The first 3 to 5 minutes of every walk should be intentionally slow. Not slightly slower, noticeably slower. This phase is your warm-up. During these few minutes, your muscles gradually increase in temperature, becoming more elastic and responsive. Your joints begin to lubricate properly as synovial fluid spreads across the cartilage. Your heart rate rises steadily instead of spiking, allowing your cardiovascular system to adjust smoothly. By the time those first few minutes are complete, your body is prepared. Your muscles are ready to contract efficiently. Your joints are protected. Your heart has found a stable rhythm. Only then should you increase your pace. This single adjustment, something that costs you nothing, can dramatically reduce strain on your body and improve the overall effectiveness of your walk. Now let's move to the second mistake. And this one is even more damaging because it affects your entire body at once. Poor posture while walking is extremely common, and most people are not even aware they're doing it. If you observe people walking outside, you'll notice a pattern. Their head is pushed forward, their shoulders are rounded, and their eyes are directed downward. It may feel comfortable in the moment, but mechanically, it creates a chain reaction of problems. The human head weighs around 5 kilograms. When it is properly aligned over the spine, your body handles that weight efficiently. But when the head shifts forward, even slightly, the load on the neck increases significantly. A small forward tilt can double or even triple the effective weight your neck muscles must support. Over the course of a 20 or 30-minute walk, that added strain leads to tension in the neck, stiffness in the shoulders, and discomfort at the base of the skull. Many people interpret this as a normal part of getting older, but in reality, it is a direct result of posture. Posture also affects your breathing. When your shoulders collapse forward and your chest tightens, your lungs cannot fully expand. The diaphragm, which is the primary muscle responsible for breathing, cannot move freely. As a result, your breathing becomes shallow. You take in less oxygen with each breath, And when your body receives less oxygen, your energy levels drop. This is why some people feel unusually tired after a walk, even if the distance was not particularly long. There is another layer to this problem that is often overlooked. Your body operates as a connected system. When your head moves forward, your lower back compensates by arching more than it should. Your pelvis shifts position. Your knees begin to move at slightly incorrect angles. This creates uneven distribution of force across your joints. Over time, that imbalance increases wear and tear, particularly in the knees and hips. Correcting posture is not about forcing yourself into a rigid position. It's about alignment. Imagine a gentle upward pull from the top of your head, as if something is lifting you slightly. Your shoulders should relax and settle naturally, not tense up. Your gaze should be forward, not downward. Your chest should remain open, allowing your lungs to function fully. In this position, your body moves the way it was designed to move, efficiently, with minimal strain. These first two mistakes alone, starting too fast and walking with poor posture, are responsible for a large percentage of the problems people experience. But they are only the beginning. In the next part, we'll go deeper into the physical factors that most people completely overlook, factors that directly impact your joints with every single step you take. Now let's move into the third mistake, and this is one of the most underestimated factors when it comes to walking properly: your shoes. Most people don't give this much thought. They focus on distance, time, or location, but rarely on what's actually supporting their body with every step. And yet, the connection between your foot and the ground is where all the mechanical impact begins. As your body ages, two important changes occur in your feet. The first is the gradual thinning of the natural fat pads under your soles. These pads act as built-in shock absorbers. Every time your heel strikes the ground, they help soften that impact before it travels upward through your body. But over time, these pads lose thickness and effectiveness. That means the responsibility of absorbing impacts shifts almost entirely to your footwear. If your shoes don't provide adequate cushioning, every step sends force directly through your ankles, into your knees, up to your hips, and eventually into your lower back. You may not feel it immediately, but over weeks and months, this repeated stress begins to show up as joint discomfort and stiffness. The second change affects the structure of your foot. The muscles and ligaments that support your arch gradually weaken. In some cases, the arch begins to collapse, a condition often referred to as flat foot. When that happens, the alignment of your entire lower body shifts. Your knees rotate slightly inward, your hips adjust to compensate, and your spine absorbs the imbalance. This is how a problem that starts in your foot can eventually create pain in completely different areas of your body. This is why proper footwear is not optional. It is essential. A good walking shoe should provide balanced cushioning, especially in the heel and the front of the foot. It should support your natural arch without forcing it into an unnatural position. And importantly, it should allow flexibility at the front, so your foot can move naturally as you walk. A completely rigid sole disrupts the natural rolling motion of your step and places extra strain on your calves and the Achilles tendon. There's another detail most people overlook: wear and tear. Shoes don't need to look damaged to lose their effectiveness. The materials inside them, especially the midsole, begin to break down long before the outer surface shows visible signs. If you walk regularly, wearing the same pair for more than a year means you're likely walking without proper support, even if the shoes appear fine. Now let's move to the fourth mistake, and this one is more about behavior than equipment. Many people fall into the pattern of walking only once or twice a week, but for a long duration. They go out for an hour or more, feel exhausted afterward, and believe they've done something beneficial for their health. The problem is, your body doesn't respond well to this pattern. Your body adapts to consistency, not intensity. When you walk regularly, even for shorter periods, your body receives repeated signals that physical activity is part of your daily routine. In response, your muscles gradually strengthen, your cardiovascular system becomes more efficient, and your metabolism stays active. This is how long-term improvement happens. But when you walk only once a week, your body never fully adapts. Each walk feels like a new stress event rather than a continuation of progress. Your muscles are unprepared, your joints are not conditioned, and the next day, you feel sore or fatigued. Many people interpret this as a sign that walking is not suitable for them, when in reality, the issue is the lack of consistency. From a physiological standpoint, Shorter, more frequent walks are far more effective than occasional long ones. Even 20 to 30 minutes done most days of the week provides a much stronger and more stable benefit. It supports heart health, improves blood sugar regulation, and maintains joint function in a way that irregular activity simply cannot match. Now let's move to the fifth mistake, and this is something that seems minor but actually has a noticeable impact: keeping your arms still while walking. You'll often see people walking with their arms hanging loosely, held stiffly at their sides, or tucked into their pockets. It might feel natural, but it disrupts the body's movement pattern. Walking is not just about your legs. It is a coordinated full-body activity. When you take a step forward with one leg, the opposite arm naturally swings forward. This cross-pattern movement is built into your nervous system. It helps balance your body and distributes movement evenly across your spine. When your arms don't move, your body compensates. Your lower back begins to rotate more than it should, trying to maintain balance. Over time, this added rotation can contribute to discomfort, especially in people who already have lower back sensitivity. Arm movement also increases the effectiveness of your walk. When your arms swing naturally, more muscles become involved: your shoulders, your upper back, and even parts of your chest. This increases overall energy expenditure and improves circulation. In simple terms, the same walk becomes more beneficial without requiring extra effort. Additionally, your arms help maintain rhythm. A steady arm swing creates a consistent pace, which improves coordination and stability. This becomes increasingly important with age, as balance and coordination naturally decline. The correct approach is simple. Bend your elbows slightly and allow your arms to swing naturally in sync with your steps. There is no need for exaggerated movement, just avoid keeping them completely still. At this point, we've covered several critical mistakes: footwear, consistency, and arm movement. Each of them affects your body in a different way, but together, they shape how effective your walking routine really is. In the next part, we'll move into the final set of mistakes, some of the most modern and overlooked habits that are quietly undoing the benefits of walking altogether. Now we come to the sixth mistake, and this is one that has become extremely common in recent years: walking while using your phone. It seems harmless. You're still moving, still covering distance, so it feels like you're doing something positive for your health. But in reality, this habit quietly cancels out many of the benefits we've been discussing. The first issue is posture. The moment you look down at your phone, your head tilts forward, your shoulders follow, your chest compresses. This is not a small adjustment. It significantly alters the alignment of your spine. As we discussed earlier, even a slight forward shift of the head increases the load on your neck muscles several times over. Now imagine maintaining that position for an entire walk. Instead of relieving tension, you are reinforcing it with every step. Breathing is also affected. When your chest is compressed, your lungs cannot expand fully. Your breathing becomes shallow and inefficient. This reduces oxygen intake, which directly impacts your energy levels. You may complete your walk, but you won't feel refreshed. Instead, you feel drained, and you assume it's due to age or low stamina, when in reality, it's a direct consequence of poor mechanics. But posture and breathing are only part of the problem. The more serious concern is safety. As you age, your body's balance systems begin to change. The inner ear, which helps control balance, becomes slightly less precise. Your body's ability to sense position, what we call proprioception, also declines gradually. Because of this, your brain relies more heavily on visual input to maintain stability while walking. When your attention is fixed on a screen, you remove that visual support. You stop noticing uneven ground, small obstacles, or sudden changes in surface. This increases the likelihood of trips and falls. And after 50, a fall is not a minor inconvenience. It can result in serious injuries, fractures, joint damage, and in some cases, long recovery periods that significantly affect independence. There's also a cognitive aspect that most people overlook. Walking is not just physical movement. It's an opportunity for your brain to engage with your environment. When you pay attention to your surroundings, your body position, and your breathing, you are actively stimulating neural pathways related to coordination and awareness. This has measurable benefits for cognitive health over time. But when your focus is locked onto a phone, that benefit disappears. Your body moves, but your mind is disconnected from the process. The solution is straightforward. Keep your phone out of your hands during your walk. If you need music or audio, use it passively, without engaging with the screen. Let your walk remain a focused activity, not a distracted one. Now let's move to the seventh and final mistake, ignoring recovery. This is something very few people consider because walking is often seen as a low-intensity activity. But even low-intensity movement places repeated demands on your body, and without proper recovery, those demands accumulate. Let's start with hydration. Muscle tissue is largely composed of water, and every function within it, contraction, relaxation, and repair, depends on adequate fluid levels. Even mild dehydration can reduce muscle flexibility and slow down recovery. After a walk, your body needs to restore balance. A simple glass of water supports that process more than most people realize. Then there is muscle tension. During walking, your muscles contract repeatedly, especially in the calves, thighs, and lower back. When you stop, those muscles don't immediately return to their fully relaxed state. Over time, if this tension is not addressed, it builds up. This is what creates that persistent feeling of stiffness many people experience. A few minutes of gentle stretching after your walk can prevent this entirely. It helps your muscles return to their normal length, maintains joint flexibility, and reduces the risk of long-term tightness. It doesn't require an elaborate routine, just consistent attention. Rest is equally important. Many people believe that if walking is beneficial, doing it every single day without pause must be even better. But that's not how the body adapts. Improvement doesn't happen during activity. It happens during recovery. That's when muscles repair, joints adjust to load, and the cardiovascular system becomes more efficient. Without rest, your body doesn't have the opportunity to complete that process. Instead of improving, it stays in a constant state of low-level fatigue. 1 or 2 rest days per week is not a sign of weakness. It's part of an effective system. When you look at all 7 mistakes together, a clear pattern emerges. Each one may seem small on its own, but their effects multiply over time. And after 50, when the body's resilience is naturally lower, those effects become more noticeable, more quickly. This is why awareness matters. The same habits that your body tolerated years ago may now be producing real consequences. But the good news is this: every one of these mistakes is correctable. So here is a simple, practical approach you can apply immediately. Start your walk slowly for the first few minutes. Maintain proper posture by keeping your head aligned and your chest open. Make sure your shoes are supportive and not worn out. Walk consistently throughout the week instead of relying on occasional long sessions. Let your arms move naturally to support balance and rhythm. Keep your phone out of your hands so your body and mind stay engaged. And finally, support your body after each walk with hydration, light stretching, and proper rest. Walking remains one of the most effective tools for maintaining health as you age. It doesn't require special equipment or complex training, but it does require awareness and the right approach. If you apply these principles consistently, the difference won't just be how far you walk. It will be how well your body supports you in the years ahead. And if you found this valuable, support the message. Follow Dr. Bennett, share this with someone who needs it, and be part of a shift toward better, more informed health habits.